Hello, friends, and welcome to the Medicare Radio program brought to you by Exact Medicare. I'm your host, Darlene Laramor. The purpose of this show is to connect with people we care about the most, and of course, that is you. We want to share some relevant news and information that will be useful in your Medicare journey. We want to help you be more confident with your health decisions, and what could be better than that? I appreciate you joining us. And I also want to say it's a blessing for me to start my day with you. It's so exciting to see all of you signing in to the Exact Medicare Community Conversations page. Thank you so much. And we've got some newest friends that just joined here over the last day or two. And let me shout out to a few of them. I can't do all of them because, boy, there's a lot coming, and keep on coming. We've got Cheryl Skyver, Antoinette Marsh, Jamie Sedlecki, Debbie Bastian, Freddie Lusk, and so many more. We just appreciate you, and I hope you're having fun. We are. We just love having you joining us. Today is an important day. It is Monday. That's not the good part. Mondays usually are a little bit of a drag, but this Monday is April 8th. Today is the day of the total solar eclipse. I am so excited I can't even tell you. Now, we're located here in central Ohio, and with a total solar eclipse, there's a 124-foot wide strip that goes all the way across our great nation, all the way from Texas to Ohio, New York, New Hampshire, Vermont, all the states along there, and right up into Canada. Are going to get to experience the total solar eclipse. So a lot of you viewing are looking forward to seeing it today. Now, it's going to be arriving at different times for all of us because we are in different time zones. Here, for us, it's going to happen right around 3:15 in the afternoon today. So I just cannot wait. The other exciting thing about the total solar eclipse is that I heard about it coming, a little over a month ago now. I'm an early riser, so I was sitting watching the morning news at about 4:30, and they mentioned that there was going to be a once-in-a-lifetime occurrence happening in the United States, a total solar eclipse. And when they brought the map up and it showed the line going down, what? That's us. I was so excited. And then I kept thinking, April 8th, there's something about that day. What in the world is it? Then it occurred to me. It's my father-in-law's birthday. No, I've told you about Dad. We are blessed to have him living with us. Oh, I could not wait until he woke up. Just couldn't wait. He's an early riser too, because, he was a dairy farmer. So his body clock is still waking him up long before dawn. But that morning, it just seemed like it took him forever. I just couldn't wait to tell him. I was so excited when I heard the beep from his motorized wheelchair. When he backs up, it's got the beeping sound similar to a truck on the road. So I thought, oh, great, he's coming out. And I told him as soon as he opened that door, I said, oh, wow, I can't wait to tell you, the whole Osmos is celebrating your 92nd birthday. On April 8th, there is going to be a total solar eclipse. We need to have a party. So I have just been waiting patiently, not really, no patiently. I can't wait for today. It's just going to be great. So I set aside a lot of things that I'm doing. I'm going to be checking out a little early today. I took a half a day off because I've got a party to prepare for. Dad's birthday party, of course, but mixed with the total solar eclipse. I've got a big family. There's going to be about 24 of us coming. I made it a little bit easier because due to the total eclipse, schools are closed. Not that the schools thought, we're going to close so that the kids can be with their parents for this once-in-a-lifetime event. No. They're worried about the kids' safety because if the children would look at the sun during the total solar eclipse, it can cause permanent damage to their eyes. So it's really important to have these handy-dandy little glasses for the eclipse. Now, I'm a NASA fan because my little brother was an electrical engineer at NASA. So I got onto Amazon, because you can get anything at Amazon. I got onto Amazon and I looked up the NASA-approved solar eclipse glasses. Aren't those cool? I can't see you, but I think I could be a little trendsetter here. I'm not really sure. I was sad to learn after I bought all these, I got 30 pair because there's going to be 24 of us, and we've opened it up to the neighbors in our condo community too. I thought, and I heard, oh no, a lot of people are not, they're advertising these as NASA approved, and NASA doesn't approve these things. But they taught us how to test them. Thankfully, the ones that I spent good money on actually do block what is supposed to be blocked. So I'm happy about that. So for our party, yeah, it's a birthday party too, so we got to have cake. So my dad's favorite is German chocolate, so we're having a German chocolate birthday cake for him. I've also ordered some cupcakes, half yellow cake and half chocolate cake in the same cupcake. So it'll be half yellow and half chocolate to celebrate the total solar eclipse. So that's going to be fun too. And then you got to have snacks. So what could be better than sun chips and moon pies? I thought that was just the coolest idea. Sun chips and moon pies. I had to get them. So I ordered those from Amazon too. So yeah, it was really good. Now, the last time we had a total solar eclipse in our area was way back in 1806. And there's not going to be another one until 2099. So for me, this is a once-in-a-lifetime experience. I think in 2099, I'm going to be looking at the eclipse from the other side. And I'm fine by that. Yes, I hope you all get to watch it. I can't wait to hear. There's going to be a whole lot of friends that are going to be watching the total solar eclipse. Please get on our Exact Medicare Community Conversations webpage and let us know how it went for you. If you don't take any pictures of the eclipse itself, because unless you have the appropriate protective equipment for your camera, because I don't want you to do whatever happens to a camera, but they were saying it could hurt it, so I'm not going to take any pictures of the eclipse itself, but I'll be taking pictures of all of our family and friends that are there to celebrate with us. Yeah, it's really good. We're going to have just a great time. And I'm glad that they did close schools so that we get to have the whole family together on a Monday. So it's going to be exciting. I better get back to business and talk to you a little bit about Medicare, the news and information that you need to know. As you're aware, open enrollment period just ended. And on that, I think I need to have a drink of my water. I hope you have a refreshing beverage too. I don't know if you like coffee or tea or what you like. I had my 2 cups of coffee this morning, so I like to have just a cup of water with a little bit of lemon in it, and it's refreshing and it just keeps me going. So I hope you have something too. But yeah, open enrollment just ended. And if you were one of the ones that got to who decided to make the one-time change at this time of year into a different Medicare Advantage plan, congratulations. It's a good time if anything has changed in your life, if you wanted different features and benefits on your Medicare Advantage plan, you can do that during open enrollment time, January 1 to March 31st. So if you were one of the ones that decided to do that, well, congratulations. Now, if you are Medicare qualified and Medicaid qualified, your enrollment process had a little bit of a snafu at this point in time. As you are aware, we've talked about it, Medicaid has got their site is down. The website that agents like me go to click I was just as quick as clicking a mouse and I could see what your level of Medicaid is. The carriers can't do that either since the Medicaid site is down. And it's not down just in the state of Ohio or the state of Texas. No, it's a national outage. They got hacked and they're doing the right thing by shutting the site down because above everything else, they want to protect your personal information. So They just had to shut it down just to protect all. So I'm so sorry about the inconvenience. We have been working very hard on this end here at Exact Medicare because our beneficiaries are getting letters from their carriers, their insurance companies, to say, I'm sorry to say, you're going to have to provide us with your Medicaid level. And people are giving us a call saying, I don't know what my Medicaid level is. I'm on Medicaid. I've been on Medicaid for a long time. I understand that you're on Medicaid, but there are several levels. There's QMB, QMB Plus, SLMB, there's full Medicaid, so many. And with all those Medicaid levels, carriers, insurance companies have made Medicare Advantage plans to suit each one of those levels. Therefore, your Medicaid level has to be verified before you can be enrolled in the specific plan. So I'm terribly sorry about that. And it's an unexpected wrinkle that has really been a problem because now we've got folks that are worried that they're not insured at all because the enrollment date is always on the first of the month. So when the first of the month rolls around, folks are feeling like, oh no, I don't have insurance. I got this letter to say that my enrollment was delayed. Please be assured, your current plan is not going to be canceled. It's going to keep going until your new plan is effective. One replaces the other. And that's for your protection. You will never be uninsured unless you disenroll completely. If you do disenroll completely, and that's something that you have to do on your own, so it's not something that can happen by accident, then you're down to straight Medicare. I don't want you to have any worries as far as that's concerned. But the process of getting your Medicaid level is a little cumbersome for some. It's a quick and easy call, but it's not something you've ever had to do before. Folks are calling us here at the office. We are glad to help. It's as simple as calling your state Medicaid office and asking them for an award letter. And award letter is going to be our term for the day. Award letter is the document that is generated by Medicaid and that you need to provide to your insurance company to let them know what your level of Medicaid is. The award letter will be a one-page document from Medicaid that says this is your level of Medicaid and this was the date that it was determined that you should be on that level, and it'll go that date. For example, February 1st, 2024 to ongoing. So that's the document that's needed. The letter that the carriers have provided you with tell you what you need to do once you get that award letter. It's as simple as faxing it or emailing it back into the insurance company. And they have given you a fax number and an email address so that it could be quick and easy for you. Now, I know a lot of you do not have computers, and anything as far as technology is nowhere close to simple or easy, and I apologize for that. If there's anybody that can help, most of you have social workers, they would be able to help too. It's just that one award letter that's needed until this Medicaid line is fixed. So we will help as much as we can. Just let us know if we can help you out. And then once the award letter is received and your enrollment process begins, that's when the insurance company is going to make sure that your welcome package gets sent out to you. Now, the welcome package has a lot of important stuff in it. One of them is your summary of insurance. That is just an outline of the coverages in the plan that you've selected, as well as some other information and your member ID card, which you always need if you go to the hospital or the doctor's office, or even picking up prescriptions at the pharmacy, or if you have any flex cards that you were eligible for. All those things will be mailed to you. And some of those will be mailed under separate cover. So I don't want you to worry if you don't get everything in one mailing. Sometimes it's 2 or 3, but it'll be coming. And as far as that goes, once your enrollment is processed, it's going to take about 2 weeks for you to receive that Medicaid welcome packet that comes from your insurance company. Please give a little bit of grace there. I know it's hard because when one plan starts, the plan that you're on ends. Make sure that for those couple of weeks that you're waiting to get your card, that you're okay on food and all of that good stuff. Now, if you need to have some access to any of that stuff before you get your welcome packet, it's a quick call to the insurance company. They would be able to set you up with an app on your phone where you could just have your card on your cell phone, and that's wonderful. If you don't have a cell phone, if you've got just a landline, they have phone services for you too. So they've tried to make sure that you are protected as best as possible. There again, if you have any questions, don't hesitate to give us a ring. Our number is 740-720-5590. There's licensed agents just like me that are ready and willing to help you. Now, that being said, if you ever call our office and you go to voicemail, please do leave us a voicemail message. All that means is we are helping another member at the time and we just couldn't pick your call up, but we most certainly will call you back same business day, as long as it's within a few minutes of end of our business day. We work from 9 to 5, Monday through Friday, and that's Eastern Standard Time. We are always glad to help. Now, just because our office here at Exact Medicare may be closed over the weekends and the evenings, your insurance company's not. So you could always call the insurance company directly, and they'll be glad to help you as well. I know that it can be a challenge when you're switching from one plan to another because the time frame doesn't always seem to be on our side, does it? But I'm so sorry about this extra wrinkle. The internet is a beautiful thing when it's working, and it always works. So this is a fluke that this is down. I've been in the insurance industry for quite some time, and when I first got in the business in the late 90s, the internet was in its infancy. Now, I still had a rate book on my desk. Rate book was the 3-ring, 5-inch binder that I would flip through to manually determine what someone's rate insurance premium would be. I was back in the home and auto. I did personal lines insurance back then. And when the internet came out, we were so happy because we could log in and get information that we'd otherwise have to call somebody for or go to the library and check out a book. Now it's just a click of a mouse. And what's a mouse? Yeah, it was a beautiful thing. And back then we thought it was just a convenience, but it has now become, and rightfully it should be, it's our go-to. It is what keeps the wheel spinning now until it doesn't. People were saying back then in the late 90s, oh, you're going to love it, they said. It's going to be wonderful, they said. Yeah, until it's not. So bear with Medicaid, bear with us. We hate to be the bearer of bad news. Don't like to tell you about Medicaid's website being down, but it's down. So they're working diligently to get it up and running again, with the utmost importance being protecting your privacy, making sure that your personal information is not going to be compromised. So please be reassured that you are safe and good. So that is good. In the award letter, once the insurance company receives that, your policy will be issued always on the first of the month. With the Medicare Advantage plans, it's always the first of the month. So they're backdating things because here we are, it's no longer the first, it's the 8th. But say your plan would be approved today, they're going to take it back to April the 1st. So you'll have your information available to you right away. So if you have any questions, again, don't forget to give us a ring. And that reminds me of some other fun stuff related to technology. We've got some really cool stuff that our Director of Communications, Jeremy, is adding to our website, to the Exact Medicare Community Conversations website. You've got to click in if you haven't done so already. One of my favorite things that Jeremy has put up on the website is trivia time. And it's a lot of different trivia, but the one that is one of my favorite is the vintage television trivia. Who doesn't love a little Lucille Ball, right? Lucy and Ricky, who can get enough of that? My favorite is Gilligan's Island. My dad used to love Hogan's Heroes. And there are quizzes that he's putting on there. So you got to take a peek. I bet the answers that I don't know. Please log in, post your answers on there. As you'll hear, he's going to be awarding stars on the website to people that get the answers. It's just a fun thing to do. So click on and see what we've got going on there. Boy, it's just been really good. So I appreciate that. And there's other things that he puts on our website too. Here in Ohio last week, we had some terrible weather. It was just awful. Tornadoes, rain, flooding, crazy flooding. We're really just now cleaning up. But on the day that all of this hit, there was a snippet of time that the sun was shining beautifully. Jeremy happened to have his camera in his hand. I say that, he probably carries it with him everywhere he goes. He was able to get the most remarkable shot of a double rainbow right over our office. It was beautiful. And he has posted it on the website. Did a lot of cool stuff with it too. He's got some camera that you just have to log in to see. I can't even explain how he did it or what it is, but it's fabulous. Yeah, log in to the Exact Medicare Community Conversations website. I think you'll be glad that you did. Well, friends, I'd better sign off for now. It's just been great spending time with you. Remember that the eclipse is today. Check out what time it is in your area. Of course, I'm sure it's on everybody's news. I know every time we turn the TV on, it's whatever channel it is, they're talking about the total eclipse. So now this eclipse is only going to last for about 5 minutes. And in the area, it's a 124-mile wide stretch that will be in the total eclipse area. And it goes all the way from, like I said, Texas, Oklahoma, Arkansas, Missouri, Illinois, all the way up to Pennsylvania, New York, Vermont, New Hampshire, all the way up to Maine and into Canada from there. So it's wonderful. Now, the next time this is going to happen, like I say, 2099, I'll be looking from the other side. So we have got to get out there and experience it. And so I hope that you will enjoy that. It's been great talking with you. I hope you have a wonderful day. Find blessings in today. I've got to get home, got to get the party started, and get ready to see the sun get mooned. Have a great day. Thanks for joining me. Bye-bye.